Based on a multidisciplinary and multisectorial approach to the study of zoonoses transmitted by companion animals, Callisto Research Project constantly refers to the One Health concept. One Health is an integrated approach to health that focuses on the interactions between animals, humans, and their diverse environments. This concept encourages collaborations, synergies, and cross-fertilization of all professional sectors and actors in general, whose activities may have an impact on health.
Callisto this year is discussing about risks associated to interactions with companion animals, and there is a broad evidence, in my opinion, of how a One Health approach can be successful. What do you think about it?
Well, the One Health approach is merely arguing that you can't separate the health of the animal community from the health of the human community. They need to be all considered together. And that means that physicians, human physicians and veterinarians should be constantly in collaboration and thinking about public health issues from both the animal and the human side. And Callisto is bringing all that very much together because of the consideration of companion animals, which really live with people in their homes. It's not like livestock animals that live out there in the field or in the stable or in the barn. These are the animals that are living actually in our homes with us. And so the potential at least exists for these animals to be a source of zoonotic infection.
Callisto is giving a broad example of the need of the One Health approach, but apparently companion animals are not so prominent in the One Health.
Well, yes, it's unfortunately a limiting factor for the good of companion animal, but I think, the fact that half of the world population live now in urban area lead to more companion animal being close to humans, and so I think that is a key factor for including companion animal within the One Health approach.
What about companion animals owners? Are they enough aware of their responsibilities, in your opinion?
Well, I think there is more and more information available for them, but the general public knows about key severe disease, and certainly rabies is an example of, when you ask the general public what is rabies, usually they know what it is and which animal transmit it. But when you will, for example, talk about plague, I don't think anybody in Europe knows that plague can be transmitted by cats, and that cats in the United States have been the source of human infection. So there is an example where you need to have more awareness about what are the risks and what are the diseases that can be transmitted.
People have incredibly intense and intimate relationships with their pets. So they sleep with them, they let their pets lick their faces, they do all these things. And most of the time, most people suffer no illness, no negative consequences from doing that. Nevertheless, we know from studies that sleeping with your animal or letting your animal lick your face is a risk. You're coming in contact with that animal much more closely, you're coming in contact with body fluids, this kind of thing. So the potential is there for that to be more hazardous, more risky kind of behavior. What we don't really know is, we don't have a good sense of how big a risk is. We know that the risk is greater for, say, children or pregnant women or someone who's immunocompromised, whose immune system is compromised. But everybody's potentially at risk, but we don't have a very good sense of how great the risk is. The bigger story is that there are potential risks. People need to be aware of those risks. Once they're aware of those risks, it's up to them to decide whether they're prepared to deal with those risks and be okay, comfortable with those risks, or whether they feel it's going too far.